Good afternoon, everyone. My name is Stephanie Hayes, and I'm coming to discuss my special topic or my educational presentation for Social Work 7378. As you can see, it is pertaining to domestic violence, but specifically intimate partner violence. And I wanted to take the perspective from the Black community, from Black women who experience IPV in the community, in their community, and within the integrated healthcare system. So let's get started. So first, let's just define what intimate partner violence is. It is domestic violence by a current or former spouse or partner in an intimate relationship against the other spouse or partner. So it can take form many different ways. It's not always physical. A lot of people think abuse is physical. It doesn't have to be physical. It can be verbal, it can be emotional, it can be economical, and of course it can be sexual. And so let's just take a look at the statistics from IPV and the integrated health system. So it is a serious problem in the US. As you see the statistics here, on average, 24 people per minute are victims of rape, some type of physical violence, or stalking by an intimate partner. And this, of course, affects men and women. Most of the time, you always hear about the women, but men are affected as well. And you see here, nearly 3 in 10 women and 1 in 10 men in the US have experienced rape or physical violence from a significant other. So it results in 2,340 deaths. That was reported in 2007. Also accounts for 14% of all homicides. And I know these numbers are much greater now. The medical care, mental health services, we lose productivity, time away from work, so on and so forth. You can see the cost of IPV was estimated at 8.3 billion in 2003 for just women alone. And I know these numbers are probably once again much higher in 2021. So talking about those statistics in dealing with our integrated healthcare system, I want to focus again on African American women or Black women in the Black community. Again, IPV it has no respect of person. It can affect anyone, men, women, Black, white, Latino, anybody. But I want to specifically talk about the plight of the Black woman. Studies show that African American survivors are those women that are experiencing intimate partner violence. They remain in abusive relationships longer than women from other ethnic groups, and they experience higher rates of injury. And so for me as an upcoming social worker, is specifically where I work now with single moms and their children. I'm also a domestic violence survivor myself. And that got me to thinking, why is that? What is that that makes the Black woman stay longer? I had to think about myself. Why would I stay in a situation? Why didn't I get the help I needed? What resources were available that I knew about or did not know about? And also the role that my environment maybe plays in me staying, or someone, woman of color, staying in an intimate partner violent situation longer than they should. So let's kind of talk about that. So here are the statistics for Black women in sexual assault. More than 50% of female homicide victims in the US are African American women. Nationally, about 9% of Black women were raped by an intimate partner during their lifetime. In this last one, Black women experience intimate partner violence at rates 35% higher than white women. And so these statistics alone, compared to what we just saw overall from the US, to me as an African American woman, as a Black woman, that is concerning. And so as I begin to look at this again, we have to look at the background, we have to look at the community, we have to look at it from a cultural perspective, even when we're talking about dealing with behavior and integrating with the integrated healthcare system, because of stigmas and different stereotypes. Black women don't always get the resources that are needed, or they're not appropriated correctly or properly. They're not spread out properly. And because of some stereotypes, there's also reasons why Black women stay in relationships that may be harmful longer. So I want to address those statistics that I just read. So the history of the Black woman, the Black community, and IPV. Here are some of the statistics that came up to me when we were talking about why, or when I was thinking about why Black women stay longer, why are these statistics so much higher than their counterparts? The role of the Black woman in culture and community. And so I'm speaking from, of course, personal experience, but also looking at the research. The Black woman in the community is considered the strong one. So if you know anything about Black women and how they raise their family, that is their pride and joy. Generationally, the family secret, a lot of things repeat themselves in cycles. And so when we're talking about the integrated healthcare and how can we assist holistically, how can we provide treatment that's going to be favorable, you have to go back when you're dealing with your client or your patients to see what background they come from, what was their upbringing, what did they learn? And in this case, we're talking about domestic violence. So what did they learn about relationships? Why do they stay in these relationships? Because their ideal of what is norm is not considered norm. These are the statistics that we see. It's not normal for you to be abused. It's not normal for you to die by the hand of your partner or to be stalked. That's not normal, right? So here we are talking about Black women in the community and IPV. We have to talk about why they stay. We have to talk about what is their core foundation when it comes to building relationships, or some of these behaviors that you see in relationships, or they accept in relationships. So the family secret is one thing definitely that I researched. And of course, again, this is dear to my heart. And we always were taught what happens in this house stays in this house. So a lot of the intimate partner violence that the Black women in the community are going through is because they saw their forefathers go through it. What do I mean by that? My mother was in an abusive relationship and she stayed, and I experienced that. So here I am now as an adult going through my relationships, and that cycle continues. And if they have children, it continues to pass on to their children. The strength of the Black woman meant we stayed because that was our house, that was our husband, those are our kids, and we toughed it out, all while getting beat up or beat down or verbally abused, right? Or people using money over us, because a lot of times the forerunners, the elders didn't work. Their home was their job. They were homemakers. So if they wanted to leave, they couldn't leave because economically they had no means to do so. The other thing I want to talk about is the angry Black woman stereotype. I don't know if y'all are aware of this, but there is something called the angry Black woman stereotype that we may be bitter, we may be angry, we are smart mouth, right? Anytime you approach us with something, we take it to another level. And so I want to really focus on this because it does go along with, I'm looking at the integrated health system, but also a total treatment team response. Because if you think about when domestic violence happens, let's look at it from a community perspective. You're in your community as a Black woman, the police come out, and let's look at the state of our world as far as systems, racism, things that are systematic. The police are supposed to be helpers, but we know we can look across now where we are, and even not now, we can take it back. We're still dealing with prejudice and racism. But for a Black woman to be the strong woman, she is stuck in a catch-22, so to speak. And I'm hitting some of these points because the first thing is, I'm in an abusive situation and I need help. But the second thing is that if I call the police, then it puts not only my house in danger, it can put my husband in danger. I just want them to take him to jail. I don't want them to put him in the back of the car and kill him, right? I don't want them to come and get me and assume that I'm angry and arrest me. And then wait, our kids are here, and it leaves our kids uncovered. And then they're gonna call CPS, and then we're gonna lose our kids. So there's a lot of different thought processes. There's a lot of different things that go on because of systems that are set up that are not culturally competent and unaware, right? So this is some of the things why Black women are experiencing or stay longer in the domestic violence situations. Also socioeconomic barriers and other inequities that prevent resources for IPV. What do I mean by that? No access to health care, no access to the mental health resources. Everything, like I said, we always think about physical, but there could be underlying reasons why abuse is happening. We don't dismiss the behavior, but what if the partner has a mental illness? What if it's something that makes them tick and it causes them to be aggressive? And basically they need a diagnosis, they need medication. But if you don't have access to the resources or the healthcare needed, that makes it hard for that person to get the help. And so the abuse continues. So also with the Black community, lack of community support when it refers to mental health and well-being, that is a thing, right? In the Black community, mental health, because of past generational things, going to seek mental health has not been very successful in the past. And so all of that plays a part in the role of Black women, the Black community, and intimate partner violence. So intervention and prevention in the integrated health system. So basically, I feel as if there should be trainings and programs provided to the care teams to recognize IPV or any other types of trauma. Also, I think of the collaborative response approach. And what I mean by that is from the time a victim comes in or whatnot, whether it's from the first responders, the health care system, the social workers, that is a collaborative response. That is a team effort. So every person that touches this victim or this survivor, so to speak, there should be a collaborative response for success. Cultural competence and diversity, that's very well needed. I said that earlier, because with any patient that we're dealing with, for us to understand why they are going through a thing, why they stick into a thing, knowing how to address them respectfully and still assist them without downing them, right? Or making them feel, like I said, the angry Black woman, making them feel like they're the cause of this, or this is typical because, you know, y'all are Black or you're a Black woman. I also feel development of tailored treatment plans, which include abuse histories and the mental health needs. Our system or our health system is good about doing assessments, but my experience right now, what I'm seeing and dealing with survivors in the counseling piece is that we're missing histories. So when the next person gets to the victim and tries to help, they're missing a whole background that can help them, give them better care. The mental health need, a lot of times with Black women, it rarely is addressed. When a Black woman has to deal with intimate partner violence, like I said before, they deal with the fear of CPS coming to take their kids, the fear of, you know, where I'm gonna stay, the fear of, you know, the bottom is getting ready to fall out of this. They don't stop all the time. If they address mental health needs, it's depression, you know, things like that. And sometimes, the truth be told, the intimate partner violence is not equated with the mental health. And in actuality, yeah, the longer you stay in a trauma or a toxic type of situation, that's going to not only play on your mental health, it's going to play on your physical health, so on and so forth. I also see cognitive behavior therapy as an intervention, one, because it allows them to deal with emotions and the feelings that are going on with the violence that they are experiencing. So those are the things for intervention and prevention with the integrated health system with IPV and Black women. Screening tools are definitely important. So intimate partner violence they have controversial issues, kind of like which screening is the best. It's kind of like no rhyme or reason, right? But these are a few that I am aware of that are very good. The lethality risk assessment is a very good one. I remember using this on a client, and for some reason she had been traumatized so and been in these situations so she did not realize that at any moment, you know, death was knocking at the door. So that is definitely one that I feel should be used. Then you have the HITS, the danger assessment. Um, the ACE test is on here, and we usually hear about the adverse child experiences when dealing with children, but I feel as if you have an adult that is going through intimate partner violence, that's again going to the environment, going to their background, seeing what their upbringing was, what they think a normal relationship is. A lot of times, if you know about the ACE test, they ask simple questions like, you know, did your mom or dad hit you? Did they cuss at you? You know, small things that people don't think is, you know, anything to be concerned about, but it is. And it also has a toll on how we operate, how we choose relationships, how we do everything that we do. So I think that test is also very important, because if you can pinpoint what happened as a child, you can understand what's going on as an adult. And then of course, the ongoing violence assessment tool is something that will be continually to be used, especially in a healthcare system where you have a repeat person coming back in, whether it's through the emergency room or regular admission. That's something that you can continue to use to assess if IPV is happening to them. All right, so this assessment, I'm gonna kind of try to summarize it. Shantae is a 37-year-old African-American female. She was married with 2 children, and basically she kept coming to the emergency room. She had come for about 5 visits during the month. And when she came the last time, she was overwhelmed. You could tell it in her countenance. And of course, this is a real case as far as the names have been protected to protect those families that are involved. But when the social worker came to speak to Shantae, she did divulge that her husband had been hitting her. And it just basically started over an argument. And so she was tired, she's pregnant, she's concerned about the health of her child. She had mentioned that she sent the oldest kids to stay with their dad until things could cool off, right? And so here we are, again, going back to some of the examples. This is a Black woman in the community. She's married, she's pregnant. You know, why is she still putting up with this if he's hitting her? It's only been a month, but she's basically at this point of where something has got to give. So she came to the ER to escape. She needed help. So this is that part with assessment. She's been to the ER 5 times in a month, and she was fine each time. No one thought, you know, well, maybe something else is going on. You know, she keeps coming back, but she's pregnant. So the big thing they could see is she's pregnant, and let's just make sure she's okay. But there was something underlining that should have been caught, if not the first time, at least by the second or third time she had come back to the emergency room. And so she did share that the police were called out to her house because of an altercation, and she even had a black eye. The police officer came and asked her, did she want to press charges? She says no, and it was an accident. And she was stating that she needed help, but she didn't want the officers to arrest her husband or kill him. And then she reflects back to something that happened to her grandfather. And she also states about CPS. So those are those factors, again, that I was talking about. This is a young Black woman that needs help. She is struggling in her home. The police have come out, who are the helpers. They didn't do a danger assessment, even though they saw her black eye. In some states, it doesn't matter if they want to press charges or not. If you have visual bruises, they're going to arrest you, or they're going to arrest somebody. And so in this particular case, the state that she was in, she was able to say, no, I don't want to press charges. So she's still there. She's still in this situation, and she's going into the ER at least 5 times in this month, trying to get help. Now, to me, I see mental. I see a whole lot of things that need to be assessed. So this was Shantae. And with Shantae, the advice the social worker went ahead and completed an assessment of immediate safety. Now that wasn't listed on those screenings and tools, but it is one of those tools. Like I said, there's several tools that you can use. But because Shantae divulged that her husband had been hitting her, this assessment was the one the social worker felt was much needed at this time to determine the level of safety for Shantae. And so there was a concern for Shantae's safety. And the social worker wanted to create a safety plan. Shantae's adamant, I love my husband, I want to stay in this marriage, you know, it's going to get better. I'm sure there's a lot of stuff that she said, you know, and as social workers, as health workers, as frontline people, you know, we want to make sure we do the best, of course, for success for the clients and patients that we're dealing with. But of course, it is totally up to them. So the social worker, because of her stating, I want to save my marriage, it's going to be better, whatever she may have said, she referred her husband to a batterers intervention program. And so that's, of course, for the batterers. There's help, you know, but they got to want it. So that referral was made. And she also suggested, which is the culturally competent part, Shantae be part of a women's group of color that supported victims or people dealing with IPV. And then she disregarded the kids because at this moment, there's no need to report anything to CPS. The kids are not harmed as far as the report was going, and they're out of the house at this time. So as you can see this, Shantae she agreed to the support program. She didn't agree to the safety plan because her situation is not that bad. And this goes back to me again, reflecting from a Black woman in the Black community dealing with IPV. Her whole thought process is, this is my marriage, this is my husband, we're getting ready to have a baby, we're just having a hard time right now, he's overwhelmed, so it's gonna be okay, right? It's never okay for anybody to put their hands on you, but these are the type of, you know, stereotypes or the type of things mentally that's going on in her head. And it would make me say, what was her norm growing up? What did she see? What did she witness? She mentioned her grandfather. As a social worker or counselor or treatment team worker, that would be something I would want to investigate further with her to see if that's something we could peel the layers off of to assist her. And so basically the social worker did assist her. One thing, the concern was Shantae did think the batterers intervention program would be good, but she was scared to share it with her husband and the fact that he may become angry. So again, the fact that he's going to become angry is a safety concern. So the social worker arranged for a follow-up to discuss the program with Shantae and her husband as a family, and also arrange for individual therapy if needed, and updating the treatment team. So this is the integrated healthcare system. Social worker has done her part. The lady came to the ER, the medical professionals assisted her, made sure physically she was okay, referred her to the social worker, and then of course, everybody there is on board, whatever updates are needed to try to help Shantae get the best care possible. So with this scenario or situation, like the barriers again that I see from an integrated healthcare system is trying to deal with stigmas. This particular case assessment did not mention it, but the provider bias and inequality of care, socioeconomic disparities, and fear. Fear, of course, was the main thing in this case assessment. Dealing with different stigmas as a provider to help Shantae. One, thinking where her background is, trying to deal with her thoughts of it's not so bad, things are going to get better, it's going to cool off. All of those would be barriers. And how will we impact change to remove some of those barriers? Education, of course, is definitely one of those things with patient-centered care, focusing on Shantae, you know, in that moment, cultural targeting, trying to investigate background, you know, culture, what's going on, those type of things, cultural competence, having enough awareness to know what to say, when to say it, and who to call. And the moment as a social worker, I would think if this was my person, hearing this story, my first thought just natural would be, okay, you need to leave, but that's not that easy. It's easier for me to say that, but it's not that easy for that patient or that woman to walk away from that situation. And underserved needs, definitely see what resources Shantae would need. If she decides she wants to continue in the situation, what's going on that's causing the anger? Is it his job disparity? Lack of income? What is going on that have shifted the behavior where this environment has become hostile? And try to meet those needs if possible, if not to provide other means or other resources to do so. My final recommendations to address Black women who experience IPV in the Black community and the healthcare system is just basically promote the healthy behaviors from the systematic view, as well as appropriate intervention from a collaborative perspective. And that's going to include change. It's not going to happen overnight, especially this I could talk about all day because I'm passionate about it. It starts with the community, meaning where they came from, their upbringing, breaking down stereotypes, to teach on what a healthy relationship looks like and patterns, and basically, breaking cycles generationally, making sure that the first responders that come to the community or deal with the Black women are trauma informed. I also would say incorporate a danger assessment. In this case with Shantae, the police officer should have definitely done a danger assessment. Changing the narrative, breaking down stigmas and stereotypes so help can be received. That's going to come from workers in the system as well as the clients that we serve, providing culturally competent care and accountability. And that's with anything. Again, IPV doesn't just affect Black women. I just chose to focus on Black women, but accountability, making the batterers accountable, us as the healthcare system being accountable to what we do. Like the point that she had to come in 5 times, that's a bit much. Somebody's antenna or the red light should have gone on, so to speak. So this would just be my final recommendation. Also incorporating programs in the community, engaging the community to teach on patterns and healthy relationships. The adults are the adults, of course, but I think about the kids or the generations, because this can be a generational thing. If they've seen this pattern of relationships or toxicity their entire life, how do we teach the young people so they don't repeat the pattern, so they can choose better and do better? And I just leave this here because again, I feel like the system has to be broken. If you look in the top, this is Reese Taylor. I don't know if you know her story, but you can read about it. She experienced violence. It wasn't by her partner, but the effects of what happened to her did cause a rip in her relationship. To this in 2014, dealing with Ray Lewis, who actually is a big football star, and laid hands and beat his girlfriend or his wife unconscious, right? The accountability portion. And so I just say that system has to be broken. Intervening earlier, helping our youth to learn to establish proper relationships. And again, it's not just the women, it's the Black fathers, the Black grandfathers, Black grandmothers. And as a social worker, that works with victims and survivors, this is just some of the things I recognize from community and the treatment standpoint. Thank you so much for listening.